Hi, this is Dr. Eric Chapman, owner and founder of Chapman Well Care here in Naples, Florida. We're a hybrid medical practice that fuses primary care and urgent care. Today's video, we're going to talk about foreign bodies that can get stuck in the ear. This happens both in children and in adults. In children, it usually is something like a plastic bead or a piece of a toy. In adults, we can get other things lodged in there too, but sometimes it's even insects. So there's all different things that can get lodged in the ear canal. So when we talk about removing a foreign body, really it falls into two categories. We can either try and irrigate the object out, where it can kind of float to the top, or you can use instrumentation, and we're going to go into that in a little bit. But the first thing is when you're dealing with a patient and you have the possibility of removing a foreign body in the ear, cooperation is key. So making sure you provide an environment that's calm and relaxed for a child, making sure that you're setting the situation up where the patient's not going to be moving around, because the last thing you want to do is insert an instrument to try and remove it. And if a patient's uncooperative or moving around, or you haven't provided an environment for them to be relaxed, then you can create more damage or impact the foreign body more, or cause injury to the ear canal. So that's really the first step, is cooperation. The second step is deciding whether you're going to use irrigation. So for example, what we have here is a syringe that you can irrigate into the canal. So this would be good maybe for like a hollow plastic bead that may float to the top. But it may not be good for maybe a piece of styrofoam or cotton or something that can expand when you make an encounter with a liquid. Then you have instrumentation. You have different types of curettes. You have plastic curettes, you have angled curettes, you have metal curettes, you have curettes that are straight on, you have curettes that have little scoopers on them, you have some at a right angle for the idea of trying to get behind the object and pull it back towards you. And then of course you would use an otoscope to try and visualize before you start to blindly go in. And then we have other things like alligator forceps. Alligator forceps have a small tiny pick at the end, so you can kind of go in and really detail, try and kind of grasp whatever it is you're removing. If you're dealing with an insect that may be alive, and this happens more than you would think, sometimes you can put a little bit of peroxide in there, sometimes you can put some mineral oil, lots of different ways to try and remove foreign bodies in the ear. It is very, very common. So this is just a quick video on foreign bodies in the ear. Again, this is Eric Chapman in Naples, Florida, owner and founder of Chapman Well Care here in Naples.